you. Thank you very much. So yeah, as she said, we are going to try to introduce you to some fresh thinking. Not that you haven't had a lot of fresh thinking, especially after last night. Nick did a fantastic job really setting up the stage, and you're going to see a lot of recurring themes actually from Nick Webb's talk. But just briefly, a little bit about WD Partners for those of you that we didn't do speed dating with yet. WD Partners is an architecture and experience innovation firm that really our services are quite broad, going all the way from insights and strategy into the consumer experience on through to the design of both digital and physical experiences, and then a fully functional operations, engineering, architecture, all included in-house, and then on through to construction services and construction solutions. We are very fortunate to be able to work with many clients across a broad spectrum of the landscape. We've got over 500 associates and work across the nation. So we aren't just a regional architect. We work in all 50 states and work with many of the brightest and best brands in the world. Many of these, as you can notice, are not just healthcare brands. These are, although we work with many good healthcare brands, we also work in retail, we work in food service, and we're going to borrow some of those analogies and some of that thinking from retail and food service, experiences that people love, and we're going to bring that into the healthcare world today in this talk. Brian?
Hey, so I'm going to introduce myself, Brian Standage with Banner Health. I always like to put a caveat that even though I'm in healthcare, I tripped into healthcare. I am not a healthcare leader that I like to at least put some parameters on by way of healthcare. I come from a background of retail, and so over 25 years in retail world with companies such as Franklin Covey, if you've heard of Stephen R. Covey, worked with them for 15 years, worked with Target organization for well over a decade, and I somewhat did trip into healthcare. A little bit of my background has some healthcare spattered throughout it, and it came to where it was an opportunity in which Banner said, listen, we have to think differently about leaders that we bring into healthcare. And I also like to remind people, they really took a shot on me. An organization that at this time had a somewhat of a larger hospital out in the West Phoenix area that was going under major transformation. The whole hospital was going to be revamped, new emergency department, new retail front. And they took the approach of what could we do differently with somebody that has zero healthcare experience, but is from the retail world. And just so happened that I also knew the chief HR officer of Banner Health, who I used to work with in the Target world, who called me and said, listen, would you be interested in at least thinking about something completely different? We'd like you to come and run one of our hospitals, but it's a unique opportunity in which we really want to do hospital delivery very differently. So I took that opportunity and took that plunge, and in taking that plunge, it got me not only in the healthcare world and the hospital side, but now that I'm in I call it the retail world, the outpatient ambulatory side. I look back into my past 7 years in the Banner Health and look at systems like Banner that are really trying to push the envelope and how do we think differently about how we deliver care. You can see some of the results with Banner, fairly large organization, $14 billion over 6 states, and really looking to how do we regionally scale, nationally scale, and do healthcare very, very differently. This is the reason what got me into Banner. For any of you that are really mission, vision, value driven, coming from a Stephen R. Covey organization, well over 15 years working with him, I'm very much defined about how I look at purpose-driven statements. I felt when in looking at Banner that our mission was profoundly one of the best mission statements I've ever read. And it is the underpinning to how we make every decision in our organization. We do not make large organization change and drive without looking at what does it do in making healthcare easier, and how do we drive loyalty and garnering the trust of a customer. You'll also hear, and same with Banner, we do not refer to our patients as patients. We refer to them as customers. They have a choice in the healthcare world, and we have to think differently about how we bring people into the hospital and how do we garner them to come back over and over again into our outpatient retail world. A little bit of our portfolio of services. I won't go through each one of these. Uniquely about Banner, we've only been in the outpatient ambulatory business for about 8 years. So when you think about seeing over 3 million patients a year in these services, we've only built this portfolio of business for about 7, 8 years. So it's rather unique for Banner to really be thinking differently and recognizing that this is a shift that's happening across the country It does not have the growth and the opportunity does not happen in our hospitals. The first impressions is where it begins. And so we've got to really think differently about the space in which we do that care and the behavior and how we deliver that care. Some of the analytics and the numbers that we see annually each and every year on that outpatient side, you can see that's 1.7. It's actually largely grown well over 2 million to this point. And so a lot of opportunities in garnering first impressions, as I call it, make sure we're nailing first impressions very differently than our other health system competitors that are surrounding us.
So obviously one of the things that we're here to talk about is the outpatient environment. And the reason for that is that outpatient growth is really extraordinary at this point. And it is going to be, as you saw from Nick's talk last night, distributed settings and the delivery of care where it's more convenient for consumers is going to continue. And we're seeing that already with inpatient volumes that are expected to decline over the next 5 years by 0.7%. But outpatient visitation and outpatient volumes are anticipated to grow by over 10%. And this is largely also due to when you look at the people that we're treating, that the age differentiation and the growth in the older segments is going to actually create more demand for outpatient in the future. So we're going to see the growth in outpatient, and it's really largely also being driven by these older consumers who are going to require a different level of care. Part of what's driving the outpatient growth are 3 big things. One of them is the technology. One of them is what can we do in an outpatient setting that we couldn't do in an outpatient setting before. So there's new technologies, and I thought Nick covered that very, very well last night. But also the way we're being reimbursed and some of the changes that are not only happening now, but that we see anticipating in the future for the way reimbursement is covering outpatient services. But consumer preferences is also a very, very large part of why outpatient growth is occurring. And when we think about the consumer preferences and study what is happening with consumers, why are they preferring these types of environments? One is that for them, it's more cost effective as well. When they shop around, and I've had some own personal experiences in shopping around for these services, and you see that you can save money by going to an outpatient venue if it's feasible for your various treatments. There's also no overnight stay, so you don't have all the hassle of the overnight stay as well as the cost of an overnight stay. But there's certainly the convenience factor. The convenience factor for the consumer is one that's not just about locational access. And we often think about that, putting it nearer to where consumers work, live, and play. And that is certainly an aspect of it. But another is, how does it feel? Does it feel easy? Does it feel convenient? Is the experience convenient? And that is a whole different level of thinking around what is convenient. And I'll equate it to a retail setting. So the mall used to be considered convenient, right? We put all of those stores in one large enclosed mall. And everybody thought, wow, that's really cool. I can go to one place and I could go to multiple stores. Well, there's this consultant who is a pretty famed consultant in retail named Paco Underhill. He was actually a cultural anthropologist who wrote the book, Why We Buy. And this is a great quote from him. He says, the first thing that drives the majority of Americans to shop at a particular mall is convenience. Once having gotten there, however, how effectively can I use it? For example, you'd go in, but it's always so hard to park there. Or there's 2 stores you like, but they're at opposite ends of the mall. Well, I think people have gone back to strip centers and said, how can we do this better? It's realizing that in America there's an obsession with convenience. I want to be able to drive up to the store of my preference, get in there, and leave. This is not a current quote. This is from 2004. And so he was presaging the demise of the mall. And that is exactly what has happened. The mall in America, the enclosed traditional mall, is going by the wayside. So retailers had to think differently. They had to come up with another model, a different model. So malls completely reinvented themselves. Malls invented themselves around what's on the top there, a town center concept. Largely exterior, largely with stores that you can have access to, drive up to, get in and out quickly. But they also expose their brands to everybody within view. They're seeing the assortment of stores that are available to you or entertainment venues that are available to you. It's also further been morphed into what we call power strip centers. These local strip centers, they might only have a dozen or so stores in them, but there's a convenient parking right up in front, and all of those brands are being shown right to you in plain visible sight. The mall reinvented itself. It created a different model. So they took away this inconvenience that was present in the old mall concept and created a new, more convenient, more accessible model for the consumers.
Hey, could I say one item in here? Because we're really on the same precipice with where malls were at, with where healthcare is at. And we've kind of had that accelerated on us by way of COVID. It really forced people to consume and think differently about where and how they wanted to receive their health care. And so we've had to really think differently about our retail space and how do we do it in the outpatient world. I'd mentioned I was in a hospital for 4 years as a chief officer out here in the West Phoenix, and there was a little bit of drinking through the fire hose when I first showed up into the healthcare world. They run things a little bit differently in healthcare than in retail. I don't know if you noticed that. And so I had a little bit of humble pie that I had to eat every now and then, really trying to drive change. But the physical change of really trying to drive a new hospital was one that I look back on with probably more of my most fond memories in my past 30 years of being in the business world, because we really had an opportunity and accomplished changing that retail front. Mm-hmm. And so as you talk about malls, we completely redesigned the front end of this hospital to be set up as a strip center, to be as a retail type of experience, to where somebody, as they pull up into a parking lot, they could text if they needed concierge service to come and get them out of their car. If they pulled up into the front end of the hospital picking up their prescription, they didn't have to get out of their car or go through a drive-through, but we would bring their prescription to them as curbside assistance. Or you walk into the hospital, we already knew that you were walking from the parking lot because we had every angle of our parking lot on camera at the front of the hospital. And we, being in the Sun City market, we had a great disposal of a lot of volunteers that worked for us. And we could deploy our volunteers before you ever even reached into the front doors of a hospital. It's that type of redirecting how we use our resources and thinking of what is a customer experience, that it actually starts far before they ever come into a building. It starts online. It starts with our web's presence. It starts with how they come into the parking lot. In the retail world, where we call it the omni-retail world experience, but it really is a co-location of creating an experience from beginning to end that really binds a consumer to say, I would not want to go anywhere else to receive care because of how convenient and how quality that care was, that there is no other value that I can get that rises to that type of delivery. So your mall experience, very, very relevant to where we're at in healthcare.
So as we think about that analogy and look at what we're doing in today's common outpatient experience, we have to ask ourselves, and I would challenge this audience and those of you in the industry, are we truly being patient-centered? I know many of you are about that, but are we truly being patient-centered, or are we doing it more for our own operational considerations? In terms of the size and the scale of the facilities, in terms of the perception in the consumer's mind of convenience, in terms of the clarity of offer, what's in that place? What's in that building exactly? I don't exactly know. I don't know. I know that it's from Ohio State University. That's pretty much all I know. Does it signal our positioning? What makes us different? How are we telling anybody that we are different with these kinds of executions? These are the questions we have to start to ask ourselves. So when we are looking at a retail experience as a firm, one of the things we think about is what Brian was just talking about, the totality of the entire experience. And it begins by understanding the consumer, really going into their head. So we utilize a variety of different tools, some of them qualitative, some of them quantitative. One of the things that you're seeing here are diaries that we have consumers fill out of their experiences. You could do mobile ethnography diaries as well to understand their experiences. Where are the pain points? What are the problems that they're having? What are the challenges that they're facing? Where can it be improved? This guides some level of innovation. And then we look at what's called ideal experiences. So we utilize psychological techniques that look at using words and images to try to understand unarticulated needs of consumers. What would they like to see? And that helps to drive idealized need states that they would have. And then we put all of that into a framework. We identify the different segments of consumers and identify the needs that they have and identify what are the experience principles and the experience tenets that we need to reflect. Basically, we're designing the experience before we've ever touched the building. And that's what we do. We build it from the inside out, not the outside in. We map those experiences. We map the flow of what that consumer's journey is. And in fact, in this case, this was for Baskin-Robbins over here, we also looked at the whole staff experience. We looked at the franchisee experience. We looked at the owner experience. We mapped all of them in congruence with one another and went across the entire cycle. So looking at this totality allows us to identify those points of difference, those points of care where we can really make a difference in that consumer's life.
If I could just add that it is extremely important that as we're mapping what that experience looks like, that we look at it in real time. Far too often, even in the retail world, and the best traditional retailers look at it, data in the rear, 2, 3, 4 months behind us after that experience is long and gone. We may be able to react and do something appropriately with that feedback. I'd really challenge us to think about how do we recreate that experience to get that feedback in the moment. We've created a platform within some of our retail locations within the Banner Health system. It's called Texas CEO. It's a new platform, never been done before in the healthcare retail type space. And what it allows us to do is anytime a customer may walk in, whether in registration or they're being seen in an exam room, my name will be on that room. And if a customer does not have an experience that made their life better, connecting it back to our mission, my cell phone is listed in every one of our retail locations. You can imagine how many texts I get throughout
He was getting several of them as we were waiting at the
Actually,
table.
I was showing them. I just got another text CEO. There's a little bit of side of it where you can be your bane of existence, but listen, if you do something with it, and so I generally speaking will look at every single text as soon as I possibly can. There is not a text that does not get responded to within 24 hours. Now, if I can, and if I have the time, I may be able to even call a customer as they're sitting in an exam room, maybe who hasn't been rounded on within 30 minutes, and they're wondering, hey, I've been abandoned here. And I've had those happen before. And it's a wonderful opportunity to call a customer right in the moment and make things right. But it's a great way to get feedback, intellectual feedback in the moment, but also an opportunity to encourage and provide feedback to our teams in the moment. But it has a behavioral change. We can get data that gives us real-time feedback. It really makes a difference analytically with what we do, with the themes of those feedback, but then strategically, how do we make it and how we allow it to make ourselves better and really driving the change. We can talk about the physical space all day long, but if you don't have the culture and the behavioral space that's appropriately and congruently aligned with that physical location, with all the work we're doing, we're really doing ourselves a disservice. So the technology space and how we look at the feedback that we're getting is equally and just as important as the physical space that we're trying to redefine and how we deliver care.
So as we look at some of the factors that drive experience and that people feed back to us as to what they expect in an experience, one of the things that are beneficial is to look at people that actually made the decision to switch. Why did they leave their provider? What happened? One of the first thing, according to Accenture, which just announced this survey just this last week, and they interviewed 2,500 consumers around the country. And when they looked at the switchers, ease of navigation was the #1 reason for switching, not the clinical experience. Ease of navigation. And that was things like they were difficult to do business with, had a bad experience with the front desk or the administrative staff. Front desk. The digital or online service and support solutions do not meet my needs. 88% of consumers switched due to those types of reasons. Then when you ask them about what are the top factors with regard to their choice for a new provider, so once they did switch, why did you go to a new provider? Access. Access was the #1 factor. 70% said access, and they defined that as convenient location and hours, as well as in the evenings and so forth, and weekends. Quickly being able to get an appointment, digital, mobile, and social types of tools. These are the types of factors that create the perception of access. So it's not just the physical location. And then when we talk to consumers about what makes you stay, what makes you loyal to a specific provider, easy. Being easy, very easy was the #1 factor. 84% said it was very easy to deal with that provider. And that it was basically how easy is it for them to do business. So these aspects of convenience and easiness are not marginal factors. These are drivers of the business when you're talking about choice. And in the outpatient world, you're talking about choice. So how do we start to build these experiences around consumers? Well, let's take an analogy from retail and use that to, let's say, women's health. So when we are working in women's businesses like cosmetics, this is a program we did for Aveda. So one of the first things you do is look at the different kinds of consumers. We profile them not just on demographics, not just older, younger, whatever. We look at the psychographic factors. We look at who they are. And we do a lot of insights and research into that. So we, in this case, looked at the curious idealist and the decisive chooser. And they were two different kinds of people, two different need states that they had. And then we map their experiences across the entire ecosystem, across the entire spectrum. And then we create specific innovative tools that we did, like for this one example of diagnosis, for looking at what those consumers would really benefit from, what would really turn them on, what would make them very engaged with this brand. And then how does it integrate into an overall ecosystem for that brand, not just the physical experience. But then the physical experience, of course, has to correspond with their needs as well, making it something that immerses them in an experiential setting that really speaks to those things that they fed to you. So it reflects the strategy, it reflects the insights that you've gathered through that process, and that's the way we would design it. And you're starting to see that happen in the healthcare world. You're starting to see brands like Tia and Kindbody develop these types of tools. The messaging, the experience, the environment, all are reinforcing the needs of women specifically, because they're not just a body, they're not just a condition, they are people. And so we have to recognize who they are and what we can do to really attract them. Let's take another analogy, sports medicine. So we did the latest prototype for Dick's Sporting Goods. And when we did that, we did the same thing. Start out with who are our personas? Who are our target audiences? And this was just one example of them, the fitness enthusiast. But then also look at all of the various ways that we can support their experience with digital tools, with their play, with their sports, with their children, and so forth. You know, how are we supporting the total experience that they have with sports because they're passionate about sports? Passionate. So how do we feed that passion? How do we make that something that works for us as a brand? And then how do we reflect that in the environment with a very experiential setting where it really speaks to them and immerses them in the things that they love? And in one of the cases here, we even not only had the digital tools, but we also had this whole outdoor area where they can try to use the equipment, try to use the cleats, try to use the various things that they were buying in that outdoor area to really reinforce the passion that they had around sports.
This is where I love being in healthcare, because I get to have the opportunity to blending the retail world with the healthcare world. And we've just seen that these two worlds are absolutely in collision course like never before. And so there's an opportunity to really segment some of these discussions that have been discussed by Dan in terms of how do we deliver these care very, very differently. And we've got a lot of different competition around us nationally as well as regionally and here in Arizona that's pushing the envelope with how we deliver care in our environment. So you can see some of these examples with Dispatch, One Medical, Village MD to CVS, Minute Clinics. And so we've really got to think differently about how can we be more nimble. How can we create an enhanced and even better? Because I always like to say, what can I learn from them? I love the fact that we have competition. I don't want to be like them, though, but I certainly do want to learn from them. And how can we differentiate ourselves to be better? We know who our customer is. And so much like the Dick's analyzation that was done, and who is our customer, we've done the same thing in Banner. Who is our Sophia? Who is she? Where does she shop? How does she consume? How does she want to receive it? Both in person and in the digital print. How does she shop it? How does she want opportunities to give feedback, such as text the CEO? So we've really been able to really change the way that we look at Sophia, because Sophia's even changed for us over the years, to really make sure that we're keeping up with the transition of who is our customer as this healthcare world evolves. A deeper understanding of consumer preferences and behaviors with Banner tailor its customer acquisition strategies. As we speak to customers they care the most about, we create more engaged customers and patients. and we speak to our customers nonstop. I probably spend 10 to 15% of my time each month speaking to customers as I round, as I call customers back, as I look at the analytics. To me, this is where the proof and evidence is where should we be going? We need to be talking to our Sophia. And so we really do, we sell ourselves short when we don't do this. I've talked a great deal in this transition from when I came from the retail into the hospital, and now I'm back in the retail world. And this hybrid approach of how we do retail and healthcare has been very interesting. I use this as an example because this has been years in the making and coming to fruition. You may have even seen it right out here on the freeway, our sports medical complex. But what we have to be great at is understanding how do they come into our system, and then how do we make them stick in our system. And when we make it very sticky for them, as in the sports medicine delivery side of our services of care, they don't just land at a sports medicine complex. There's opportunities in which they get sports medicine care far before they ever come into this complex. Either they may come into my sports medicine urgent cares, they may come into an occupational sports medicine complex, they may meet with an orthopedics, but when they land into a sports medicine facility as this, it is a complete concierge level of care and how they're cared for. And you can see some of the examples here. We serve everything from professional athletes, high school athletes, college athletes. We're at the local level of every high school in college sports here in the Scottdale area. I personally go and work with athletic directors to ensure that they understand what does the referral process look like with Banner as it relates to receiving sports medical care. Some of the accounts as well as organizations that we work with that attend and work at that sports medicine complex, it's a brilliantly made complex because it integrates personal care with sports care at a level that I've yet to seen accomplished within, at least in Arizona. Next slide. One other example, this is a recent Health Center Plus. It's right up here on Scottdale Road. You can get to it. It's about 3 miles down the road. You're welcome to tour it. Would love and welcome you to tour it any time. But this is a concierge suite of care that we provide not only to the general public, but also to executives. It's a one-stop shop in which you'd have an urgent care, imaging, orthopedics, cardiovascular, full suite of primary care, all the way down to other specialty services where you would not even need to go anywhere else, even landing straight into a surgery center. Makes it very, very unique with how we've positioned such of these care environments, such as the sports medical complex, this executive health of our Health Center Plus, and how do we make a one-stop shop outside of a hospital look and experience something that they've never experienced before. Just as if you were to go to a Target, as if you were going to land at a place in which you needed to pick up 5, 10 different items, our care should be concierge in a way in how we not only deliver it, but also coordinate that care through the lifetime value and cycle of how a consumer receives the care. A couple more, just some pictures of the Health Center Plus and how it looks and feels, how we navigate it. It's been fantastic, and it's been open for just about a year now. So some examples, just some new concepts of retail care just within the community of the Phoenix market that are new for Banner. And all of this is brought on because of how and what Sophia has told us over the years.
So as we wrap up, we wanted to just leave you with this challenge, that a quote from the CEO of Ardent Health is, much has been made of the impact of the traditional health system from disruptors like Walmart or Amazon or CVS and others. I maintain that the biggest threat to our industry is our own unwillingness to disrupt ourselves. So that's the challenge. Can we disrupt ourselves? Can we disrupt the thinking that we have about how we do things and the forces that are making us do those things? Or can we apply some fresh thinking? And so that's the challenge we would leave you with. We've got like 51 seconds to take questions.
Any questions in that 51 seconds?
Probably mostly for Brian.
All right.
Thank you for the time. I'll be here for a bit if there are any questions.
Thank you. And then you can download the presentation there.